You're listening to Body by Poly. I'm Dr. Alain Polynice, and this podcast is for anyone considering surgery and navigating all the complicated decisions to make before, after, or somewhere in between. Let's talk about what really matters. Let's talk about BBL safety, the Brazilian butt lift. It's still a very popular procedure, but it's one of the procedures in plastic surgery associated with the highest risk of mortality. Matter of fact, I think there's a 1 in 15,000 chance of having a serious complications or death following a BBL. And why is that? It's based on the nature of the procedure. So in a Brazilian butt lift, you're taking fat from different parts of the body through liposuction. You're harvesting that fat and then transferring it to the buttocks to create more shape, more volume. But the key thing is where to inject the fat. So the fat should be injected in that layer of fat right under the skin. If the injection is done too deep within the muscle, that gluteus muscle, that's where you can run into problems. So within the gluteus muscles, there's some very deep blood vessels, especially a big vein, that if you inject fat into that, you would create a fat embolus. Basically, fat would get into the bloodstream of the vein and then get carried to the lungs and cause a pulmonary embolism, and that very often can be fatal. So the key thing in a BBL is, number one, finding a plastic surgeon who specializes in these types of procedures and does many of them and does them safely. A second is not overfilling. You know, as anything, you want to do things in moderation. If you overfill and you try to just inject too much fat into a very tight space, that's when you can run into problems. There have been a lot of safety measures implemented in order to minimize the risk of complications and death in BBL. But one of the things that can be done is using ultrasound guidance, which is using an ultrasound during the procedure to show you the layers of tissue beneath the skin down to the muscle so that you know exactly where you're injecting. But again, I do a lot of BBLs, and the technique that I use is very simple. It's just a slow, methodical technique where I know exactly where the tip of my cannula is at all times, so I know that it's in that nice fatty layer right under the skin. You never inject at an angle that would allow the tip to be within the muscle at all. And being conservative, not overfilling the area to ensure that the fat stays within the compartment where you want it to be. But unfortunately, there are a lot of places and practitioners who are doing Brazilian butt lifts with very little to no training. So that's where you can run into problems. So it's important to do your homework, do your research, find a surgeon who does many of these consistently and does them safely. And a BBL in those hands is no more dangerous than any other plastic surgery procedure. Thanks for tuning in to Body by Poly. If you found this helpful, hit subscribe and follow along on YouTube, Apple Podcasts, or Spotify. See you next time.